Hi, Comrade Jesse.
Hi, good evening. How you doing?
Welcome. You're one of the PNP heroes, Comrade Jesse. For those of you comrades who don't know, this is Comrade Councillor Jesse James
Mhm.
Clarke from the Trafalgar Division, the infamous Trafalgar Division where Comrade Jesse ousted those
Mhm.
names that we should not call, but
Yes.
one of the ones that we wanted to oust, and we felt very good for ousting. So welcome. He's
Thank
also
you.
the opposition spokesperson on
Mhm.
health and wellness. Is health alone or health and wellness?
Health and Wellness, Junior Shadow Spokesperson for Health and
Junius,
Wellness.
you're the junior shadow spokesperson. You see, I had deputy. So, Comrade Jesse is the junior shadow spokesperson on health and wellness.
Mhm.
And that is what we want to talk about tonight, Sir
Yes.
Jesse.
No problem.
Now, health and wellness, I'm very passionate. As you can see from my scrubs, I'm a
Yeah,
healthcare worker.
yeah,
So, of
man.
course, I'm very passionate about health.
Yes.
Now, last week, the
Mhm.
Minister of Health and Wellness, Dr. Christopher Tufton, made his budget speech.
Mhm.
And the opposition spokesperson himself, Dr. Alfred Dawes, actually poured cold water on
Mhm.
the entire presentation. He actually said that Dr. Tufton is out of touch with reality, the realities of healthcare in Jamaica. What is your take on what Dr. Dawes had said?
No, I totally endorse the statement or statements that have been released by Comrade Dr. Dawes. One of the things that jumped out for me from the presentation of the Minister of Health is the code care program that they have going on in terms of attempting to clear the backlog of surgeries that they have in the public health system.
Mm-hmm.
The ministry set a goal of 2,000 of completing 2,000 surgeries, and they only did 1,500. And I think they're about to scrap the program too as well. And the issue that I'm having with that is that that does not fix the problem that you have in the public healthcare system. I have not seen the kind of effort that we'd want to see in terms of equipping our own health facilities or hospitals to be able to execute or increase the capacity in the amount of surgeries that they'll be able to do.
Mm-hmm.
Not only the facilities, was also in your technical person, in the personnel too as well, to carry out these surgeries. What the government has been depending on heavily is public-private partnerships.
Mm-hmm.
Now, I don't have a problem with public-private partnerships, but it can't be that you're outsourcing everything in the public health system to private persons and not putting in the effort to improve your own public system. So anything that can be done in-house inside the hospitals, I don't see why we should be paying to have them done outside, because that should be a backup option, but not the way of operating. So you have persons waiting, and the program only cater for persons who are waiting for a year or more. You have persons who have very life-threatening, who have serious, like cancer-related surgeries to be done, who have been waiting for months. And you imagine that is something that is time sensitive. You
Mm-hmm.
can't be putting off cases like that repeatedly. So a person's waiting a year or more,
We had
and
our own case of that with our dear departed comrade Stephen Ram Williams, who was waiting
yeah,
on his surgery and
absolutely,
passed.
absolutely.
So we
So
totally understand.
and this is one of the things with healthcare, is one of those areas where when you're not doing well, you can make it up, you can use PR to cover it, because the people feel it, and it's something that they feel very personal and very dear to them, because their loved ones get the bitter end of the stick. They go to these healthcare facilities and they can't get the service that we need. So my problem is that we not only have we not cleared the backlog in terms of surgeries that we have had, but there's not enough effort from the government to fix the remedy problem in the tertiary healthcare facilities to ensure that we are in a better place. So if we're able to do 5 surgeries per year last year, we should be able to do 10 this time around. I'm not seeing that kind of improvement. So that is one thing that is very concerning for me too as well. Um, and I noticed he kind of does slide over it too in his presentation. And I think we really need to get to a point where we just be truthful. Our healthcare is in an state of emergency right now. Um, I was saying to somebody that there's not normally on the island, you could probably point to a hospital and say, well, okay, well, this particular hospital, if I get into any kind of difficulties, I can be transferred here, or I can go to this hospital. and it will have all the services that I need at this particular hospital. We're in a case now on the island where you don't have one hospital on the island that can meet all the services that you would want. So you find, even if you go to the Kingston Public Hospital, you might find that they're telling that a particular imaging machine isn't working or they don't have
Like
any.
the CT,
Right.
the
And the
CT, man.
MRI and things like that. So you find that you see it being repeated over and over where you don't have access to ambulances to transfer to the external facility to go under the test. And when you depend solely on these public-private partnerships, you open up yourself to be abused. Not saying that all these private companies are up to what you call it, illegal activities in terms of maybe not providing, not giving you value for your money. Not saying that all of them are like that, but you open up yourself to situations like that when you depend on them solely for some of the basic things that a hospital should have. If you tell
Can I
somebody
tell
that
you
this is
something? As a private healthcare practitioner, the government has placed such a burden on the private healthcare facilities that if I, for instance, in my capacity, I can order x-rays and MRIs. If I send a patient to one of these private facilities to order a study that I need, like, no, if somebody come to me with a knee where swell up like big and me need to see what's wrong with it and send them, then I give them an appointment for like 3 weeks when I need it now.
Yeah,
This
and
is
that is
what this is the
unacceptable.
burden that the government has placed on the private
Yeah.
healthcare facilities because they have basically shunted all their patients. So all of the patients them come into the private health. So there's even the private healthcare facilities are run down now.
Yeah, and the wait time that you have inside the hospitals too, because of how understaffed they are and under-resourced they are, it puts the staff that you have currently working in our public health system, it put them under severe stress. And when you find that when you turn to the hospital, as a patient, like any customer, you don't care about the logistics behind why you're not getting the service or anything. You just want the service and you need it, and you're going to get it.
Especially if it's an emergency.
Absolutely. And that put you in a position where the workers who you meet on the front line end up in confrontations with them, and people end up attacking them and quarreling with them when they're not really the bulk of that's not really where the problem starts from. It starts from when you have a minister who is in denial about what is happening in healthcare, not funding anything. The kind of training that see they're talking about giving scholarships and so on is woefully inadequate. It's just a little, so it's like
Piecemeal.
yes, what I find that they do is like if you need 2,000 of something, they come and make a big announcement that they're doing 100, and they make a big deal about that they're doing 100 when it's way below what you actually need. We from I just became the shadow spokesperson for health and wellness. When I was working Dr. Guy, we made the proposal that you should be looking at because every population have certain diseases that you are exposed to more than others, and you have that are higher in your population. So you should look at the complications from your diabetes, your hypertension, your cancers, and so on. Look at the personnel that you will need, the specialists and so on, and send persons to be trained whether locally or abroad, and ensure that you retain them. You put them under a bond or whatever, and you offer other incentives, whether it's housing or low interest rate to purchase more first vehicles, whatever it is, to make it attractive for them to want to stay. Because now what they have happening now, a case in hospital is as people settle on, sometimes they don't even enter our public healthcare system. They're leaving. And because they're under so much stress and they're underpaid, they're on their way out. So even the ones you're seeing there now, I guarantee if you go to the hospital this month and you go 3 months later, it's a different set of staff you're seeing in most cases. One time back, your sister used to be a elderly, somebody who's a senior nurse. That is not the case now.
No. You see, that's the thing, because what this does, it affects our continuity of care. So the older people, the younger ones would benefit from the experience of older people. And so now we have a lot of mistakes being made by inexperienced people, because when you have to use people who were out of school recently, like a year ago, and you put them in senior posts, because the senior technicians are all they've all been taken up by the other countries, then there is no continuity of of the learning curve. You
Yeah.
understand? So you have some rookie mistakes being made. For instance, I have a friend who lost her baby last week at the hospital. The baby was overventilated. You
Wow.
understand? This is something that experience
Yeah.
would guard. And so this is what we're seeing, not just in healthcare, we're seeing it in education as well. Anywhere there is where a lot of the skill sets are being exported. This is the
Yes.
problem, you know?
Yeah, and that is part of the problem. And we have to remember the kind of minister that we're dealing with. This is a minister that who wanted to fire doctors in the middle of a
Yeah,
pandemic when we needed them the most. So that's the kind of person that you're dealing with, and who the opposition has called in many cases for collaboration. We are willing to help however we can, whether in terms of organizing, um, however we can. We are willing to help, and he has not reached out to us any at all, even though the
he
offer has
won't.
always been there.
He won't.
And I'm
I've been
saying,
battling with this man from he was named the minister. He will not.
and
You know?
healthcare and education, these things you have to have partnership in order to get them done properly, because they are very big ministries and you cannot afford for them to fail because of the magnitude of the impact that you're going to have. So if
Exactly.
we are once again telling him that you need to look at the issue in terms of you need to equip your hospitals. So the staff need to have all that they need to work with. You need to equip your hospitals. You
I'm glad you
must
brought
train your
that up.
personnel. You must
You
train your
know, Mrs.
personnel.
Escobar, who is on my live right now, she is another host. She had on I don't even remember who she had on another Byfield. She had on Comrade Byfield just a little bit before. But
Mm-hmm.
she's talking about tetanus shots being unavailable in the hospitals. You know, the fact is that we're in a situation now where the government owes the suppliers so
Mm-hmm.
much money that
Yeah.
nobody is supplying the hospitals, nobody is supplying any hospital with anything because the government owe money all over.
Yeah, no, that is true, but the finance minister would also tell you, giving you a glowing picture of our financial situation and our net reserves and things like that. But you find that the important things that will affect the lives of the population and of the people who cannot afford private healthcare or healthcare of the island. So we have to ensure that, and the reality is that any one of us can end up in a hospital
Exactly.
any given day. You can have an emergency on the road or whatever it is, and they take you to the nearest hospital. You don't know which hospital you will end up in. So it's very important that we all come together as a group and push to have our hospitals, the type of quality of care that they can get inside of our hospitals, improve. I mean, we push for mobile healthcare from the opposition side, and what we are seeing now with the Know Your Numbers campaign, which is what they were trying to copy the mobile healthcare, is a start, but it's not what we want, because what you have happening now is like a mobile health fair. We don't
Yeah.
want a mobile health fair. What we want is mobile health care, where you're
Continuity.
going, where you zone these areas where you're having, based on what your numbers tell you, where you're having the spikes of certain non-communicable diseases. And you go inside these areas, and you also, with the electronic health record system that you have, you start now scheduling persons for the next appointment automatically, and you are reaching out to them. So you don't just go pop up in our town and say, "Oh, I'm doing a health fair today," and you just
Right.
do some random testing and you take some pictures and so on. That is the end of it. And you go away somewhere else and you do it, and you don't go back to that spot until probably next year again. And it's a different set of people. We should have that continuous follow up, and automatically the system should be able to flag you based on your age group to say,
Right.
okay, you need to be back here in 3 months' time or 6 months' time to repeat this particular test. And we come and find you based on whether the illness you have or the age group you're in, to screen you again for certain things. So you find that we are not doing enough in terms of screening. So most persons cannot afford. I was saying to somebody too as well, that when you look at somebody who's struggling to find the money just to put food on the table, it is difficult for you to ask them to spend any kind of money to do any kind of screening outside of their and even within the public system, it's expensive for them because they have to pay the transportation most times to get to the area, and they have to lose the entire day at work too as well. And some persons cannot afford to lose one day's worth of money. So that is where the mobile healthcare would come in very useful, to get into those areas and to do your health promotion in those areas where, yeah, your deep rural areas, and also in some of your communities, even your urban areas where you need that kind of education to take place.
Especially your patients that suffer from mental health conditions.
I am so happy you went to mental health because it's an area that is totally so I am in Kingston, so I can tell you specifically about that one because I've had several run-ins with that. The mental health department is your most underfunded department. So if you have so I've had persons in the division who are having a particular episode, whether it's on the weekend, especially on the weekends, it's like you're on your own,
Yep.
right? Because the unit is going to tell that they only have one vehicle. And when they deal with mental health patients, one patient can probably take you a couple hours just to get them to the side for thing. And you find that there's this bounce around sometimes when you call for the help of the unit. The police don't want to come because the police are going to tell that they are not trained to deal with them. The mental health
Can't
unit is
blame
going to
them
tell you,
either.
yeah, and the mental health unit is going to tell you that, well, we would love to come, but we need the accompaniment of the officers to come with us if this patient is violent or have any type of weapon. So you find if you don't do some sort of legwork and organize it for yourself, it's very difficult to get the mental health unit to respond to any type of mental health situation or episode anybody is having. And when you're on that list, what happens sometimes if you don't keep calling every day to put your name back on that list, they just bump you off and they forget about it totally. So it's an area that we don't pay any attention to any at all.
Yeah. And the thing with mental health is that it contributes to other outcomes because when a mental health patient, for instance, becomes violent and injures other people, which has been happening a lot in Jamaica since them closed down Bellevue. Remember,
Pretty
this
much.
minister closed down Bellevue, stop admitting patients to
Patients, yeah.
Bellevue,
Mm-hmm.
talking about community health care. So what he did was try to implement, and the community healthcare model is a very good model now, which was
But
basically
it needs support.
spearheaded by the late Professor Fred Hickling. However, he wants to do part of it without funding the other part, which
Absolutely.
is to ensure that you have community health aid workers who can give the medication.
Right. So they're underfunded. So the mental health unit is absolutely underfunded. And I don't think the government appreciates the kind of work that they have to do. You have one unit for all of Kingston and St. Andrew. Impossible. And the work, the mobile that team that comes out to like to respond to calls to pick up persons and so on. They start working after regular work hours most times. So they can do like a couple or a few per evening. It's absolutely underfunded. So sometimes for me, it is very heartbreaking when you see persons the for the mental health awareness day and they come on the news and all that, but there's no real support to show that you put in your money where your mouth is. There's no support for it on the ground, and that is a big problem because I have had cases where is this police officer sometimes will do you a favor and
Yeah,
help you to bring somebody in to the mental health, to bring to KPH now, and that even that too is also another problem in terms of how you manage the mental health patients and the interaction with regular patients. Because sometimes
exactly.
you have that kind of crossing happening and it's not the safest thing. So there's all of that needs to be taken into consideration. I think if the government is willing to admit that we're in an emergent situation and said this is really where we are at and this is how we are going to go about it. We need field hospitals like we had during COVID to deal with some of the issues that we have in. We are going to have to send some of our personnel to be trained, get specialized training, sometimes off the island, for them to come back because we have a shortage of those particular expertise. There are some very talented persons in the healthcare system here who can be trained locally to do some of the things that we are doing, and they're just not able to because of the heavy workload that they have and they don't have the funding to go back to school. I'm saying the government can fund them to go back to school, and when you look at the research, it's showing you what you need to do to ensure your workers don't leave as quickly as how you don't have that high turnover of your staff. One of the major reasons for that is the employee feeling like they can move up or they have or you
Yeah,
care about their personal development, and the government have shown no interest in that. So when somebody make the personal sacrifice to invest in themselves
themselves.
and rank up, they're not going to
Exactly.
stay and accept any pay. They're not going to because they
Yeah.
have no reason to. So it's something that the government needs to look into. Medicine now is almost $5 million per year. Who can afford that?
$4.5 million per year.
Who can afford, and that don't include some of the other things that you need as a student. Who can afford
Exactly.
that? You know,
Exactly.
those are the things that we need to we have to address. So if you have to make up your mind and decide whether you want to pay for it now in terms of the training, or you're going to pay for it dearly when you have your persons dying and your workforce dying and people being traumatized, because we can't take death lightly. Even death of a baby
Exactly.
is life changing for entire family. I
That
tell
is true.
people, when a woman loses a child, you don't know, that could have been her only chance to have a child.
It
You
happens all the
understand?
time.
So you can't just take it lightly and think, oh, it's just another one and so on.
I'm
And
glad you bring that up.
mhm,
Yeah, because we want to talk now about emergent healthcare in terms of um, just our whole emergency situation, trauma, A&E, the lack of the unavailability or inavailability of ambulances. There is literally no emergency health services available. And I can speak as a trained emergent, I'm a trained EMT and paramedic, so I can speak from that perspective.
no, it's
That if
true.
somebody should have an accident on the road, um,
We don't have a dedicated burn unit either, still,
no, we
and we have been
don't.
calling for that for years. And burns is something that happen with a lot of motor vehicle accidents, domestic violence, whatever it is. We don't have a dedicated unit geared towards that either. As you say, we don't have the ambulance services either. Remember, I don't remember that young man back in St. Elizabeth from BB Coke High School where his classmates attacked him and he had head injuries. And he
And they had
spent
to lift him
over
up.
almost 48 hours before he was able to get something basic like a CT scan done, because Mandeville never have any. He was coming from St. Elizabeth, went to Mandeville, they never had any. And the minister, to take shame out of his eye, paid for
Made
him
a
to be
big
transferred
made a big deal out of it too.
to UA, to have the scan done. No, that can't be the case, because I'm telling people not every case gets national attention. A lot of these things happen all the time throughout the day, and the persons die, and you just don't hear anything at all about it again after that. And there's
We can
nobody
bring it
there.
closer to home. We can bring it closer to home. Just 2 weeks ago, Comrade
Right?
Rohan Waship Bryan
Right. Our
passed
counselor,
away
right?
because of the
Mm-hmm.
inavailability of the unavailability of an ambulance
Ambulance, right?
to take him from Princess Margaret
Mm-hmm.
Hospital to KPH where he needed life-saving intervention.
Absolutely. And sometimes, I tell people when you're having a crisis, or you have an emergency situation, time is absolutely important. Those first few minutes,
Yeah.
absolutely important. If you get some sort of stabilizing care, it can go a long way in saving your life. So and there's another thing too. Every year on holidays, we see where persons drown at particular beaches. We know it going to happen. We know it happen.
Treasure Beach.
Absolutely, we know them. But the government has not done anything in terms of having trained lifeguards, especially out for
Lifeguards.
holiday seasons, having an EMT team there at these particular locations. There's nothing like that. So you find that it just keeps happening over and over and over, and it's almost like a tradition. And I'm saying the government needs to be proactive when it comes on to these things and to healthcare. Um, just to remind everybody about the resolution that we did, I think it was probably 2 years ago, for mobile healthcare, which is where the minister got the Know Your Numbers campaign from.
Okay.
It was routed through the KCMC as a resolution.
Living
Comrade
ideas
Eugene
as
Kelly
usual.
and Councillor Charmaine Daniels worked on it with them, and they were able to have it passed through there. Through,
Okay.
and that's where it actually got the attention of the minister, and it tried with the Know Your Numbers thing. So if we don't try to fix the problems that we have and pay close attention to them now in terms of healthcare, we're in for a very rude awakening. And I don't want it to get to a point where, well, it's already at that point, but I don't want anybody else to lose their life unnecessarily, and it can be avoided. It's just unfortunate that we refuse to equip our hospitals. This you have the same health minister for so many years now. He has no excuse about why certain hospitals don't have certain basic equipment. There's no excuse. There's no reason why the only two cancer treatment machines, the Linac machines we have on the island, one is at St. Joseph's, one is all the way in Montego Bay, and there's none in central Jamaica. There's none on the north. There's none on the south. So if you need to use that
Can I
machine,
tell you something?
mhm,
cancer technology has gone way ahead of linear accelerators. Linear accelerator is old technology.
Yes.
They are now talking about gamma knives and C knives. When I left that part over 10 years ago, they were talking about gamma knives. So even the Linux machine is old
Outdated.
technology.
Right.
And this is why they're having such a hard time to find somebody who can fix it. Are we gone way past that now?
Absolutely. And you touch on something that is important that we have not been doing as a country. We have not been paying the type of attention we need to pay research and development. We have just been ignoring that. And what we have been doing is depending on research coming from other populations. You have to do your own research and development from your own population. There's no reason why Jamaica can't develop its own drug. When people were surprised that the Cubans could develop a vaccine, and the Cubans were like, "But we make all our drugs."
Exactly. But
this
can I tell you
is the
something
first
else?
vaccine that we are making.
They
When
make all
last
their
year
drugs.
Jamaica developing something?
We developed an eye drop for glaucoma out of cannabis, probably about
That was
when
Dr. Henry Lowe.
yeah,
Yeah, but
a
that
few
wasn't through the
years back,
government
probably
either.
10 years ago.
Yeah,
I know
and that
he
was
got funding from
right,
overseas.
and that wasn't even through the government. So that I'm saying the government is not investing in this kind of research and development and having our own drugs and coming up with our own solutions, even in terms of surgical techniques, in terms of how we treat with our population, because every population is unique. Something might not do well in a particular population, might do better in yours. A drug that
But
does well in one population might not do well in your own. So you need to be doing that type of research and development on your own population. And we have not done that. And
but the irony in it, Comrade Jesse, is that doctors from the region gather here in Jamaica, most specialists, most specialties for various Caribbean conferences, and most of them invite the minister or members of his team, and they would have been made aware of some of these technologies. For instance, let us talk about even cancer care and research. The minister was at the same conference I was attending when because you invite these developers of the technology. They come here, So it's not that they're not aware. They just don't care.
Yeah.
Because they know about it. Because guess what? When any of them get sick, all them do is take a plane or a helicopter and go to Miami and go sort out with the same thing where we don't have available here.
Yeah. And it's unfortunate that and I think that is also part of the problem, because if they had to suffer the injustices that the regular population had to suffer, it would force them to change, because there's no way you could be satisfied with what is happening now in healthcare. And there's also another part to the healthcare thing too as well that is not as popular when you mention it, but it's something that I believe is absolutely important, and it's something that I'll continue to push and advocate for, is the accountability inside the healthcare system. So what I want us to have a specialized unit that is able to investigate and prosecute whenever you have persons in the healthcare system especially when you have persons who die under questionable circumstances. I believe somebody should give
medical negligence.
Yes, and some sort of investigation, external investigation should take place. Just like how when you have any type of fatal shooting or police behaving inappropriately, Indicom just comes and take over everything.
Yeah.
You can't tell them no, you're not giving them your gun or anything.
Right.
They just come and take over everything. So you don't have a case where you as a patient can't even get your docket to do your own private checks and things like that. You have to be begging and asking.
They cover up, and these healthcare professionals cover for each other.
So we want a unit that has persons with the medical expertise, but also that kind of criminology expertise and investigative skills.
Forensics kind of thing.
Right. So you can dig deep into these cases where you have these deaths where you don't know whether there's a baby, anything that is healthcare related. And to even investigate the minister too as well, because it's not only most times the blame gets pushed onto some sort of public sector worker.
Exactly.
But when you really check it back, who really made certain decisions? So, example, in COVID, we ran out of oxygen, and you had persons dying, and we don't know how many persons. Even though we don't know how many persons died because of that. You need to have some sort of unit that can investigate independently and say, well, this is where the problem started from. This particular person can be held for manslaughter or whatever it is, and you take it from there. Because I and it's not an attack on the healthcare workers because it works both ways too. Because patients still lie too. Because
Exactly.
working in healthcare too, I know that patients still lie too as
Exactly.
well, and
Yeah.
patients will lie on you too. But at least you'll have that independent body that will be able to say that okay, this is actually what happened instead of your story, the story, my side of the story, and you know the waters get muddied and you can't find docket and this is missing and so on. Somewhere we can get that kind of independent investigation taking place. I think it's something that we absolutely need to have because one of the things we need to bring back in healthcare is the heart. We have very bright people sometimes, but they don't have any heart in terms of how they deal with the patients, the customer service,
It's
and emotional
PTSD.
intelligence.
It's
You know,
PTSD.
yeah, and that too as well because they're
And we're
overworked and
suffering.
so
I'm telling you.
absolutely. It comes right back around to full circle in terms of how we pressure them and the kind of pressure that they're on. Because it has to be frustrating working in a job where you're expected to perform at peak levels when you don't have the equipment you need
You don't
and
have anything.
you can't get leave, you can't get vacation when you want to and so on because you just under that kind of pressure. So it comes full circle. So it's about putting in all different pieces to the puzzle and have that
Exactly.
holistic accountability in healthcare too as well.
You know, before I forget, we need to also speak about the US issuing their tier
Sure.
3 warning
Mm-hmm.
about visitors coming to Jamaica. A lot of people assume that this is for crime only. However, they don't realize that the US warning was also healthcare related, you
Mm-hmm.
know? And we've seen where the minister, the US, the ambassador Audrey Marks, they've been petitioning the US government to get rid of this warning. What they call it again, the level 3.
Yeah, but why would the US is just being a responsible government? You
Exactly.
wouldn't want your population travel to a country where they're high risk, where if anything at all happened to them, they know that the emergency service is not able to respond efficiently or properly to their particular needs. You wouldn't want that. So you're not going to send your encourage your people to go in an environment where they are
You
not
have an
safe.
advisor, that's
Not,
it.
apart from maybe the high crime and violence, but to say something happens, you can't get proper care at the healthcare facilities that are nearby. When you tell somebody in the States that you have a hospital that don't have a MRI, a working CT scan machine or MRI machine, they can't understand that.
The,
Because that is basic.
exactly. A
That
CT
those are the
machine
things that make a
is
hospital a
basic.
hospital. Yeah, very basic.
Exactly.
Those are basic things. Our
I,
X-ray machine not working. Those things are very basic. You have
um,
doctors' offices that have those kind of things. So it's is
exactly.
is why would you encourage your persons to go to to visit a location like that? It's not safe, and
It
if,
is
and
not
they need to
safe.
and they need to tell the people it's not safe, and Jamaicans need to realize that we are living in an environment where it's not safe. You can't afford to get sick here. It's just the truth.
Exactly.
You can't
You
afford, and
know,
people die every day because they just can't afford it.
there are certain conditions that a CT scan is essential within the
Hmm.
first half an hour to
Yeah.
90 minutes. For
Hmm.
instance, a stroke. If a
Hmm.
child should fall on its head, you
Right.
understand?
Hmm.
Bustamante Children's Hospital don't have a CT scan, a working CT scan machine. So if a child
Hmm.
should have a head injury
Hmm.
and they need a CT scan, they have to leave there. And I
Yeah.
mean,
And
I,
and trans- and one of the things we need to point out to people, this is why I am so I always speak out against these public-private partnerships because it is dangerous to be transporting. There are inherent risk in transporting a patient that is ill, that is
that's
that
what I
is
was about
severely
to
ill like
say.
that
Yeah,
from one place to a next place to do a test and then back to the compound because sometimes you have patients who are so sick that they can't transfer them, and doctors just have to
exactly.
do the best with what they have, and that is
Exactly.
not acceptable. So these situations are not ideal, and then you run the risk of them telling you straight up that they don't have any ambulance available. So you'll have to now find a private company again and pay them to do that kind of to do the
Transport.
transfer for you.
Exactly.
It's not safe. Yeah, transporting a very ill patient is not ideal. It isn't. It's not the ideal situation. You don't want to be moving up and down somebody who is sick like that.
And one thing I forgot to even mention to you is I don't know if you are aware that KPH literally has no gurneys, no stretchers in the accident and emergency unit.
Well, KPH is a special place. I tell you that the staff down there, they really fight with keeping that place open and running. They really do, because a lot of times they don't have a lot of things that they need. In COVID, even some of the basic things sometimes you don't have
Alcohol.
shoes, you don't have thing. Some in COVID, I remember when the vice president for the Nurses Association, when she came out on the news and she said that they don't have any water. Or
Yeah,
they don't have any soap
with
available,
COVID.
and she have to bring her own. That those are the realities. So sometimes some of these healthcare workers, they're under severe stress because they have to be using up their own resources sometimes to ensure that they're safe to deal with you out of the small pay that they're getting. And then sometimes a lot of them, out of the kindness of the heart, they care for patients too as well. So we need to take healthcare serious, and the emergency care as well as the preventive care too as well. We can't continue how we have been operating. It just can't be done. We need to have spaces in the island where you know that you can go to and you can get the services that you need. We need to have that.
Let us now go to the big white elephant in the room, Cornwall Regional Hospital.
Oh, Cornwall
Now,
Regional Hospital.
yeah, recently the minister, well, I saw a release in February where they spoke of the 21 billion, the new 21 billion price tag.
Mhm.
But the minister went into parliament and said that we were telling lies, and he didn't say that. I went back and looked at the article, because I wanted to see what it is. The article said the Ministry of Health has stated that the Cornwall Regional refurbishing has a price tag of 21 billion. It never said Cornwall plus Falmouth plus type 5 health center, which is what the minister is now saying. You understand?
And it goes to the accountability that we have inside healthcare, and in terms of from coming from the ministry point of view, in terms of them being held accountable. Cornwall Regional is like is a sword that has just been festering. We are in what, 7 years now, and
8 years this year, actually.
right, and you haven't finished the renovations that you said that you wanted to have them completed, and the type of inhumane conditions sometimes that these patients have to endure, and the staff have to just be living. You have the lab working out of containers. You have your staff in a space where it's not the best working environment, and you just have this project dragging on, and the price tag just keep increasing. The project just keep expanding and expanding without any type of proper explanation to the public in terms of. And you know what, one of the problem I have is that if the minister would just come forward and just be honest with the people and say, okay, this is where we're at, this is what we want to do, this is whatever, or I should have considered building a new hospital in the first place, and so on and things like that. But when you come and pretend that everything is all right, when you're wrong and strong, as they would say,
Exactly.
it leaves a bad taste in
Very
the mouth of
wrong
people,
and strong.
because when the staff and the patients have to go to these healthcare facilities, and when they go to Cornwall and they can't get this particular service here, you have to go down or to Falmouth to get this particular care done, then back. It is just too much. And as I said to you, there are people, the majority of persons can't even afford to find food for today. And when they have to be moving about, it's not good for them. Corner Regional, I don't understand how you start up with a project and you're moving from like what, 5 billion?
2
And
billion they started
2
out
billion,
at.
right? And then
Yeah.
you go to 5 billion, and then when the opposition tell you that based on what you think, that won't be able to, you mark them. And then you end up at 10 and 11 billion, then 14. Then you just keep going. It's like every year
You're adding more.
you just put
But
on another 5 billion on the project every year.
have you been there? When last have you seen it?
Yeah, man, I've been to Cornwall at least 3 times. I visited Cornwall Regional Hospital. In terms of the adolescent hospital that they're building, there's more urgency on that. So I'm expecting that to even be completed before the actual Cornwall Regional Hospital itself. Because you see more urgency on that side, but in terms of the Cornwall Regional thing, you
Renovations.
don't get that sense of urgency on that side either. So, I mean, the work has just been progressing really, really slow, and we don't know if it's intentionally slow or what it is. But
I
with
think
these,
it's a cash
I
cow.
find, I find that this government is more interested in doing construction projects. I
Yeah.
don't know what the reason is than to actually fix the problem. So we're not saying that we don't want new hospitals and we don't want new whatever, new health centers and so on. Yes, but the focus also have to be in equipping what you have and maintaining what you have and ensuring that the services that you currently offer up to standard. It do something that can ease the burden now of the persons. You can build
Exactly.
full field hospitals, you can set up operating theaters in a short space of time and increase the amount of surgeries that you can put out. Approach it like it's an actual emergency, but don't just run down to do these construction projects. What we're going to end up now in a case, is that you're going to have two major projects going on now, Spanish Town and Cornwall and Huey
Three.
and Huey too as well. Going
Exactly.
on,
Yui. Because he
and
just announced Yui.
with this ever expanding price tag, that is what you're going to end up with. And now you're going to have three major hospitals being not running as efficiently as they could be, based on the fact that they are construction zones now and so on, and the impact that that is going to have on the population. So I'm saying, even try and finish one project first and get that out of the way before you jump into another one. And there's nothing being done to address the needs now. That kind of a short term need that you have now. I'm not getting the push that the government is interested in at all. Matter of fact, I get the feeling that the government is more interested in divesting the public healthcare system, because they
Yeah.
just keep moving more and more services out of the
Private.
public system into the private. Now, when you go to hospital, when you go to the doctor, when you go to the hospital now, you're basically getting like everything. If you need to do surgery, everything you need, you have to get you get something to go on the road to buy it,
Yep.
to come
That
back
is
with.
true. You end up saying,
That is what is happening.
I
So it,
have I have a question for you though.
yeah.
What what do you think of reversing free public health care to a situation where those who can afford should pay?
What I think we should have is not a case where I wouldn't call it a full reversal, because I believe in free healthcare.
Yeah.
If the country is able to afford it. So I believe in free healthcare now, but you have to put the money behind it. So if you're going to go free, you can't just get up one day and say you're going to be free. You have to now put the funding behind it to support it. So what I would suggest now in the short term is to have like a standard fee where that is just the amount you pay right across the board. So whether it's like $1,000, everybody pay $1,000, irrespective of what you're doing. It could be big surgery, small surgery, or whatever it is. You have like a flat fee that is heavily subsidized, because of course $1,000 can cover the cost for anything you're doing at the hospital, but it will help to cushion the blow to, so that you can pay for some of the basic things, that in terms of having tissues in the bathroom, soap, those basic things,
Alcohol.
alcohol,
Alcohol.
those basic things.
Panadol.
Those basic things. So
Well,
if it's a case where we're not whether we don't have the funding or we're not putting the funding behind it, just to cover those basic costs for the time being until we're in a position, because I think free is the gold standard. That's where you should work
free.
towards. Yeah, to just
Yeah.
that's what we're pushing to
But
get to.
how
But if
about
you're
tapping
not
into
there,
the insurance companies though? Because a lot of people
hmm
who access these services have
hmm
insurance coverage. For instance, let us look at UA. U is model,
hmm
I think, even though
yeah,
U is technically not free. But
yeah,
what UA does is taps into your health insurance. What
insurance,
about a system where people who come once they register, you could find out, basically there should be a system where it can determine whether they are insured or not. You
yeah,
understand? And you
that
tap
is
into that.
that is also an option you can use to fund healthcare overall. Having that kind of national insurance for everybody too as well. That is something you could look into, as well as making it easier for the diaspora to help too as well, because the diaspora is always willing to help and to push, but sometimes we make it so difficult for them to help. The
Especially now.
yeah, the bureaucracy and the politics will make it so difficult for them to help that they are discouraged from this. They're not encouraged to help. I think, a matter of fact, your education and your healthcare, I think we should have like a 60-40 split where the diaspora contributes to that fund specifically for that. So those things take, I know what these use these funding to the specific projects. So whether we're going to say, okay, we're going to buy a new MRI machine for this particular hospital, no, and everybody knows what we are going to do, what the money is, and maybe you can have it being have a special committee set up to spend that kind of money, because sometimes the persons donating from abroad, they have lost faith in the political system, where they want it to be the funds to be managed by somebody who's non-political. So or who is independent of the direct politics. So that is something that you could look into as well, because the diaspora have a lot of persons within it, whether from their skills or with their financing. So it's something that we need to find a way to tap into, and a way of having that skill exchange, because the diaspora is not just about sending remittances. That type of skill exchange that can be facilitated, where our people go there and get training in a particular area, and we have a training in another area, because we are good with athletics, so we can say, oh, we train some of your athletes, you
But,
train some of our doctors
but
and
the
nurses.
diaspora people are being frustrated, Comrade Jesse,
No,
because
absolutely,
the members of the diaspora
100%.
try all the time to donate. I have a friend. He was on the live earlier, who
Yeah,
tried to donate something as simple as the stands for the IV bags.
yeah. Hold on,
Right?
one second. You could excuse
Sure.
me 1 second. I just going to plug in my phone.
All right. Comrade Jesse is back.
Yes,
Welcome back. Your battery
yes,
cut out.
yes. Thank you so. I must apologize to your listeners for that. Sorry
Yeah, man,
about.
that's all right. We totally understand is technology.
Yeah,
All right. So where were we now? We were talking about, oh Lord, we
we
talk about
spoke
so much
about
things.
we spoke about Cornwall Regional and the different
Right.
projects that we had going on in terms of the same construction taking place all over in terms of.
Somebody says Carrie cut the line. Would behave, would so terrible. Yes, so may have some questions about Cornwall Regional now. I went there, I took a friend there last year, October, and ironically, she unfortunately passed away last Sunday. But she was a kidney patient, and I took her there to get dialyzed. And I was appalled by the conditions that I saw. It literally looked like a tenement yard. I worked at Cornwall Regional for a while because they have us doing clinical rotations. And while I was there, they had us the back where they have now converted into the hospital. That
Yeah.
was actually the quarters for all the healthcare professionals, nurses, doctors, physios like myself. That's where we stayed, especially when we were interns. I was an intern at the time.
Mhm.
And I was appalled to see that they have one building where they put the wards, so to speak, and then the next building right in front, literally 10 steps away, is where they have healthcare professionals who are living. So a patient can literally look through his window and look into the room of a nurse.
Mhm.
This is how bad it is.
It Cornwall Regional is really in a bad state. It really is. And dialysis services, it's very expensive to do it privately. And when you have to do it publicly, you have a waiting period too as well, because of it's because of the high rates of all the different conditions you have in our population, like the diabetes and so on, that can damage your kidneys over time, and the autoimmune diseases and so on, as well as persons, all the different reasons why you could end up going into renal failure. It's something that is in high demand in our country, and we are nowhere near meeting the capacity. So you find, and it's something that you must have. It's not something that you can live without. You have to have it. And depending on how severe it is, it increase the frequency of how often you have to have it done, and that's part of the problem that I'm saying. I'm saying that if your population has a high rate of a particular illness, it means that you over time should become an expert in dealing with that particular illness
Exactly.
and all the other complications that come with it. So Jamaica should be the leaders in terms of diabetic care and
Hypertension and diabetes,
and
lifestyle diseases.
eyes and all of that. They should be experts on that, because those are the things that get affected. Those are the organs that are affected mainly when you have chronic diabetes and or chronic autoimmune diseases. So, and some medications too as well can also damage your kidneys.
We have a list. We have a commenter asking, "How are the donor list? How is the donor list? What donor list? Twitch? What donor list? You mean kidney donation? We don't do that here."
It and it's hard to find somebody with the appropriate match. And remember, even when you do get a kidney, it don't have to last a very long time either, and your body can still reject it just the same. Even when
We
you
have
do
no
get
care.
a
We have
kidney,
no
so
available services to manage
yeah, so that
organ transplant here.
yeah, and dialysis is something that is needed is a service that is needed in our population. Is very expensive for those persons who need that kind of service to get it done. And as I said to you before, it sometimes people make the decisions between doing what is right for the health and finding food to eat for today. So it is another area that we are lacking in terms of the amount of units that we have catering to persons who need dialysis. That is Dr. Guy's baby, by the way. He always
Yeah, the dialysis. But kidney disease in Jamaica is almost a life sentence, especially end-stage renal failure,
mhm,
because, as you said, the dialysis is so
yeah,
expensive and there are not enough
not available.
units available. And the private, if the person is not insured, they pay perhaps
Expensive.
around
Expensive.
18 to 20,000
Mhm.
per dialysis, and most of them need dialysis 2 to 3 times a week.
Yeah, very expensive. Very
Yeah.
expensive. So and you have to travel to a site more than likely to get it done to as well. So the transportation cost and all of that, and somebody has to come with you most times too as well.
Yeah,
Because afterwards,
exactly.
yeah. So it
All
is
right.
expensive.
It is. I want us to switch gears now to maternal health. Recently there were two um in February, university had its annual fertility conference,
Yeah,
and there was a professor there that did a presentation
yes.
on the increasing
We're not having
maternity.
enough children.
Pardon me?
You mean that we're not having enough children, or the fact that our
No, no, we're not talking
mortality
about. Yeah, well, it's the same conference.
rate?
Because basically it's a biennial conference. It's not every year, it's every 2 years,
Mm-hmm.
where the fertility department at UA, which is a combination of the OBGYNs and the fertility unit, everybody have this conference. And so they have different topics. So one topic was the reducing birth rate, which is of course is of concern. But not only that, they are at that conference. They also spoke about the correlation between skin bleaching and decreased
Mm-hmm.
sperm count.
Yeah.
Yeah, but we're not talking about that. We're talking about maternal health now and maternal mortality rate.
Mm-hmm.
That's what we're talking about now. And we spoke about it on the live 2 nights, not yesterday, Saturday night, we spoke about it. Where since this is the highest the maternal mortality rate has been since
Mm-hmm.
between 1981 and 1983. But also the minister himself mentioned it in Parliament. I think they had their own study where they are blaming it on COVID, that this is the highest the mortality rate has been because of COVID. But it actually started
It
increasing
wouldn't be
from
just with COVID, no.
2019. When you disaggregate the numbers, you see that it started to climb
Yeah.
from 2019. So have you're aware of this?
Yes, and something like that wouldn't just because of COVID. I mean, we blame so many things on we blame all the ills that happen in healthcare on COVID. Like
Exactly.
we never had a healthcare system or persons were getting sick from before. Your infant mortality rate is one of your key indicators in terms of how well you're doing overall in terms of healthcare.
Yeah.
And overall how your country is doing in taking care of its vulnerable population. So once you start have that going getting high, and it's not something that just spiked up overnight. It has been creeping up bit by bit over the years to where we are now. It's something that have to ensure that you do the relevant research to find out why is it happening. And I mean, we have our own suspicions. I mean, I love when I have the hardcore scientific evidence, but we can definitely see why. The truth of the fact of the matter is that is an era where you find just talk to any mother who had baby within like the last 5 years in a public health care facility, and they tell you about the experience that they had. Um, you look at the outbreaks that we have had in terms of neonates dying on the ward because of
Bacterial
bacterial outbreaks,
infections.
and that does have to do with the infection control and prevention, which is basic public health.
Yeah.
So you find that once you start falling down in those areas, not covering them, and that could be coming back. Not saying that this was a reason for that, but it could be coming back down to just not having the different things you need. Well, the minister himself said that they never had enough personnel. So that's where he placed the blame. But it could just be having to do with just not focusing enough on the basic things that you need to maintain the hygienic conditions in your facilities. So that could also be a problem. And we still not have had the full PAHO report from those incidents either. We just had a case where the minister pulled out what he wanted to pull out of the report and to tell the country. And we have pushed very hard for that. So it's one of those things that when we win the next election, we can go back and pull that file to see if we can get the unredacted version of the PAHO report so we can know exactly if if there are things in there that we needed to know to help to fix the problem that the country was not made aware of. So that is also something we can look into too as well. But it shows that we have to I believe that if you had an effective primary healthcare system, you'd have that tracking taking place of that pregnant woman from the minute she's and you would have her care being monitored over that particular period of time. There's a time when you in Jamaica when you were pregnant, you get like even food supplies, things like that for both before you had the baby and after you had the baby.
I know. I had baby during that time. My son is 24. They gave us everything.
Right. So
Yeah.
that type of care you would normally get is missing, and it's
In the
something.
90s into the 2000s, that's what they did. You understand? Where when you have the follow up, you could go to clinic,
Mhm.
well baby clinic, everything you get your
Yes,
baby formula.
yes. And midwives would come to your house and look
They
for
came to
you.
my house. They
They
came to
came
my
to your
house
house
with my
and follow up with you right through until you're fully recovered.
the
Yeah.
domiciliary nurses. They
Yes.
came to my house, dress me, fix the
Everything.
baby, clean the baby wound,
And
right up,
they will give you new mothers training on the spot in real time, how to
yeah,
breastfeed the baby properly
teach
and
us how
all of
to
that,
breastfeed.
how to take care
Yeah,
of the
I
baby,
went through all of
everything.
that. I went
And
through all of that.
they'll also offer the kind of support if in case you're having the depression, postpartum
Postpartum depression,
depression
yeah.
and so on. They would have that kind of maternal care. At that type
We
of
had a very
community,
robust maternity health
that type
system
of
back in the
community
90s and the 2000s.
and house to house healthcare is what is missing. And when you
Yeah,
have primary healthcare falling down and all the burden now is dropped solely on the tertiary, that is what you end up with.
yeah,
And so that type of care is what is actually missing. And I think that is why we're seeing what we see now um, in thing, as well as the overall economic condition of the population too as well. Is also impacting that too because you find that the type of conditions that our people are living in, in communities, and sewage just running on the road, and they're living in a very unhygienic conditions, and because of
yeah,
the economic situation, the diet might not be as what is supposed to be for the new mother and child and so on. So all of those factors are playing a significant role in terms of what we're having. But if the hospital don't have certain basic things, trust me, they don't have the other things that they need. And this is where now you're seeing a shortage of midwives in the system being played
yep,
out in front of your eyes. It's being played out right in front of your eyes now because those are the persons now who would champion the maternal health and reproductive health and be out in the community doing that type of work. The shortage of those kind of healthcare workers is where it's showing up now, and you won't be able to get away from that. You have to spend the money in those areas. It's absolutely important, absolutely important. And the type of healthcare I'm pushing, I want it right across the board. So it should be a case where if as I was saying to you earlier, for example, for a man, once you hit 40, once you have any type of interaction with the healthcare system, we don't know your birthday, they know all of that. Once you hit 40, something automatically, because we have such high rates of prostate cancer, alarm should automatically go off on the system saying, okay, this particular person living at this
exactly.
particular address needs to be screened now for PSA and the physical exam and all of that. And you go and find these persons and you get it done. That is the type of um, healthcare you have to go to. You have to be aggressive now with it because of the increase in the high rates of non-communicable diseases that we have. The non-communicable diseases, they are killing more persons than the crime and the accidents put together. So it's something that we really have to tackle it aggressively. And you find in the hospitals, most of the patients there are because of no complications from non-communicable disease or chronic non-communicable diseases. So it's something that we really have to tackle and really push, not just driving around and talking on a loudspeaker and saying this is what you should do, or spending money on ads and all of that. It's something that you have to get on the ground and actually do the work. It
We
is,
are we are segueing into the next thing I wanted to ask you about now. The ministry's PR budget. It seems that the PR budget in the ministry is bigger than the budget for anything else.
yeah, and it just it just shows you what the thinking of the ministry is and the leadership of the ministry is that they think the public relations is the most important part of the healthcare. Health promotion is important, but you have to. I don't think a lot of persons they know what they need to do, but they don't necessarily have access to do what they need to do. So what we need to focus on is spending money to ensure that everybody has access to high quality healthcare, and that is where we are lacking. There's no
Yeah.
access to high quality healthcare. What we having is even when you do get to your major hospitals, is you can't get what you need. Your health centers, you can't get what you need in your health centers. Some of the equipment that required that hospitals don't have. Those should be at some of your regular healthcare centers.
Exactly. Like
It
a
should
CT
be,
machine.
yeah, that should be at a healthcare center. That shouldn't be anything that is the ultrasound and so on. That should be
Ultrasound.
any health department to go into on the island. You should be able to get those things done right off the bat.
My office has an ultrasound and I work in a very small office.
Exactly. That those are things that
That
they
is
can.
basic.
And as a matter of fact, now to where the technology is now, you have these mobile units for all these things. So you have the mobile version for
Ultrasound. Handheld.
all these equipment you can think of. So there's no reason why you can't be mobile and get into the communities and do all of these tests that you need to do. All your machines that need to do your different blood tests too as well. You can have them in the mobile version to get them done. So it shows where the priority is. It's about looking good
Exactly.
and looking like you're doing something instead of actually doing something and making a difference on the ground. And for me, I would prefer to be making a difference on the ground and to ensuring that the persons have proper health care than for me to just be promoting the ministry and promoting whatever else there is
Promotion, health
and spending
promotion,
all this
spending
money
all of this money
on
on
that. Yeah,
marketing.
it is. And when you're in an emergency situation, your priorities have to change and you have to some things you have to shift your focus from, not that they're not important, but when you're in a dire situation you have to just like in your body whenever you have any type of crisis taking place, whether it's blood or whatever it is, your body now automatically starts sending blood to the vital areas and forget about the
Exactly.
critical stuff.
Exactly.
So that is what we need to be focusing on now. We need to get our primary health care where we need the mobile health care and also equipment in our hospitals and training up your personnel. You can't get away from that, allowing your research and development. You cannot get away from that. 'Cause even some of these equipments, we should be building them now locally.
Yes. We have the thing about it in our Comrade Jesse is that we have the expertise here. In my profession, we use a lot of equipment. You
Mm-hmm.
understand? As a
Mm-hmm.
physiotherapist, and we have the expertise here. If something should go wrong with my ultrasound machine, there is somebody that I can call to come and fix it. A lot
Mm-hmm.
of the hospitals used to have these people employed to service. Let me tell you something. I worked in public health care in the early 2000s when I just left school in 2001 till about 2005. I overlapped before I went into pharmaceuticals. But during that time, we used to have people who service the machines
Yeah.
because we used to send them abroad, get them trained by the companies that make the machine. We send them away, the biomedical technologists, we used to call them.
Yes. Mm-hmm.
And they used to come and they were hired by the hospital. So if your CT machine breakdown, CT scan breakdown, you have somebody on site who can come fix it. Sometimes there's some simple things wrong with these machines,
Yeah.
but they scrapped the whole of that because I used to have my mom's neighbor used to do it, used to work with them. They had laid him off. You understand? So they don't have, they basically cut those people out of the entire system. This is why we're having the problem now.
There's
And
no
that's why I
maintenance.
know they're outsourcing. Because with this outsourcing, what they're doing now is fattening the pockets of them friend now who own these little private healthcare facilities.
Mm-hmm.
Even, was it Maypen Hospital or Mandel? I think it was Maypen Hospital where they put up one such facility out of the blue.
Man never does outsourcing too because even that young man that I was telling you about, the private hospital that they had the arrangement with, without calling any names, The hospital that had the arrangement with, they didn't have a functioning CT scan machine either, which is why he had to be transferred to Kingston. So you find that, and I'm hoping one day we can get an audit of all these public-private relationships that we have, because I am convinced that there is something happening there. I think it's something
Yes.
that definitely will
Yeah,
happen.
because they encourage, just like how with the funeral home scenario, them encourage them friends to
Yeah,
go into these businesses.
yeah, you have to really know look into, because it can be that you want to just, as I'm saying, it's almost like you're stripping the hospitals, like it's a way of divesting hospital. That's why
It
what I
is.
call it, because
It
all the
is.
services now you have them just going out to more and more service going out to private persons, and the effort to equip your hospital to do it, I don't see it. So that is a big part of the problem too as well.
But but even as I mentioned, the funeral home situation, they're also divesting that, because we were made aware the other day that even University Hospital, because Dr. Dawes also did a release on that.
Hmm.
University Hospital has been, the morgue there has been divested to Archers as well. Let us talk about that whole situation with the divesting of the funeral home services, because that is also
Yeah,
another hot button topic we need to
I
touch
know
on.
I have cases where you have some of our constituents complaining that the distance that they have to travel in terms of to for the loved ones, whether they have postmortem to do or whatever it is, or where the bodies are being stored. I know that is also an issue, but it just comes back to what I'm saying earlier. There is no effort in maintaining what we have. It's almost like we are saying that we can't afford to run health, we can't manage to run healthcare at all. So we have to be outsourcing every section of it, and it shouldn't be like that. The government should have its own mark by now, in terms of that can be dealing with the
They
with the bulk
did. They
the
did
bulk of
have
it.
their own marks.
I know, but it should be something that we be using now. It can't be that you keep leaving the population or exposing them to private persons and to private companies, and you just keep shipping out these services to them one after the other from every year. It's almost like you're scrapping down your hospital, and I don't like that, because the public is at a disadvantage whenever you do things like that. I've not seen a case where the patient or the population is in a better position because you have divested. The outsourcing should be something where when you have exhausted all of your capabilities and you have no other option, then you start to that, and that should be a temporary measure. It shouldn't be something that you do continuously. We have been having that, and one of the complaints that I've been receiving too as well, in terms of persons when they die, is that the long wait time that they have to wait to get the postmortem
Autopsy.
autopsy done and so on. And they say it's a shortage of staff, shortage of pathologists and so on. Again, it's just because you
The
know
funneling everything into a few facilities.
right, and I'm saying it's not a surprise to you that you're going to need a pathologist. It's not a surprise to you you're going to need nurses, medical technologists, public health people. It's not a surprise to you. If you're organizing healthcare properly, these are like it's like a
Basic
skeleton,
essentials.
your core of your healthcare.
I know, so when PNP turn government, we have a whole heap of cleaning up to do in
No,
healthcare.
a lot of work, and a
Crazy.
lot
It's
of
like building
auditing
a
to
whole
do as
system
well.
from scratch.
A lot of auditing to do too as well, because I said to you, something is going on, and
Yeah.
something that we need to definitely dig and look into, because it can't continue like that. We have people's lives at risk, and we can't continue.
All
Mhm.
right. So we're going to touch on one of the sensitive topics now. I heard Deon Jackson Miller mention earlier and beyond the headlines that it's been 5 days now, and the Ministry of Health hasn't issued a release on the recalling of the AstraZeneca.
AstraZeneca. Mhm.
What are your thoughts on that?
I think it's a learning moment for the country, because I think we kind of lost our. I think fear took over during COVID, and persons we kind of lost our way, or lost some of the principles of healthcare. One, I don't believe that you should force anybody to take any type of
Drug. It's
drug.
actually
It should be
against. It's
It should be
actually
it should be voluntary.
a violation of basic
But
human rights.
during COVID, that went right through the window.
Yeah,
Persons
they
were actually,
violated the human
yeah, you
rights.
had persons who were actually fired because they never they were
Many,
hesitant
many
in
people.
in taking the vaccine and so on. No, I am a believer in the science. I'm a believer in vaccination and medicine and all of that. However, I never believe you should force anybody to take anything at all. What you should do, just like how any other in any other profession, you give your professional opinion,
Advice.
advice, and you let the patient decide what they want to do. Because, for example, some people don't want any blood product because that is their religion, and that is their
Exactly.
right not to take that. So it is something that we have to look back. Also, how we treated the privacy of medical records. You had people who felt like it was okay to just ask you, "You're vaccinated, or you have had COVID," and I'm saying, while it's something that is common and so on, it's still your personal medical record, and it's your personal business. So, is you should treat it just like any other infection. You won't walk up to somebody and ask them if they have this or they have that, or if they have been tested for things. So I think during COVID, because of the fear factor that was behind, persons never wanted to die, and it was a new disease to us, well, and all, I think we kind of we lost our way a bit there, and it's something that we need to look on as a country. And this brings me back to the point again. If we were doing our own research and we're on top of our own research, we wouldn't have to take vaccine from anybody at all. We'd be able to do our own vaccination, our own prevention, whether it's something else that's maybe not a vaccine or whatever. It could be extract from a particular plant or whatever it is. So it brings us back to full circle to that. But the ministry is now opening the door for people now to say every and anything, and you expect that the ministry would have led the narrative on the withdrawal and come out and say something, but they have been absolutely quiet.
But what
And
are they gonna say? What are they gonna say? Because they violated basically every Jamaican's basic human right by signing an indemnity clause where if anybody in Jamaica should even suffer from the very same
you can't
adverse
get anything from
reaction,
the company.
they
Yeah,
can no longer claim from the company,
yeah.
right? And I personally believe that the PNP should lead the way for a class action lawsuit against the government. First of all, are they tracking who has had this adverse reaction? Do
Mm-hmm.
they even know
How
what
many
are
persons?
what the occurrence is? How many
Yeah,
persons per 100,000 in the
yeah,
population
yeah. The
would be get?
prevalence.
Are they
Mm-hmm.
doing any mapping? Because
Mm-hmm.
I worked as a pharmaceutical representative
And
for
which
12
batch
years.
might have?
Pardon me? Right. So what I'm saying is, from the get go, there was no adverse event tracking. So you don't know, for instance, who ended up with this side effect or another, right? And this is where they dropped the ball because AstraZeneca themselves should have been doing this in our population. They should have been doing this right across the world. You
Yeah.
understand? So that's why I ask you now, what would you expect? If you were the minister, what would you say given all that has happened?
Well, I mean, I don't want to give them any ideas, but I'm just saying that if the first thing, they should not allow to come out in the news first before they say anything to the population. They should have been on top of the ball in the international space to see what was happening internationally, and to come and be proactive and come to the Jamaican people and say to them, listen, there has been a withdrawal of this particular drug. These are the particular side effects that it's having in those particular population. Because I remember persons in the earlier stages, you had women who came out and said that whenever after they have taken the vaccine, it has changed their cycle. And some people just thought it
That
was
was
just
one of the
mind.
first side effects noted. It's
Some
the
persons
same, and it's
thought
the
it was
same
just
condition cause it.
mind over matter.
Because
But you have the research papers now coming out and saying that,
a
yeah, that is
lot.
one of the side effects.
But
So they should have come
but
out and explained to the
Pfizer
population.
is next because they're having issues with the Pfizer one too. And
Yeah,
people don't
I'm
realize that.
suspecting that they're going to have issues with all of them. I'm suspecting that. So they should have come out and they should have also said to the population that, okay, we're expecting only 2% of persons, or 5 or 50% or 70%, whatever it is. And if you start to experience this particular symptom, This is a number you can call to come in to have us assess you and whatever at our cost or whatever the case might be. There's, as you said, it has been days now. They haven't said anything, and it's very worrying when you do that because you have persons who probably like me who believe in the science and whatever and got vaccinated. You'd want to hear what is happening from your leadership. I mean, I will do my own research and find out and thing, and I stay on top of the international news and all that. But you need to know, explain to the regular persons who, when they did the mobile drive to have them vaccinated and all of that,
And told them that it was from
yes,
God.
you now need to go back to them and explain to them what is happening and if they're having any side effects, see how you can intervene. And as you said, do the research to find out the prevalence that you're having and what our population is experiencing. It has just been, the silence is really bad. It's really bad, and it makes you lose confidence in the entire healthcare system in terms of the management of anything. But they need to come out and say something now. It's really bad. They need to come out and say something and explain to the population what is happening, what is the way forward. They need to come out and do that.
Yeah, I totally agree with you.
And again, it is something that we need to look at and learn from it because a lot of persons lost their job, lost their jobs, they lost friendships, broke up. All of that happened over
The
the
government,
vaccinations.
the government encouraged vaccine
Yes,
discrimination.
right. So the fear factor behind that and all that, and it was not coming from a scientific place either. So that is something that we have to learn and look out for because these pandemics are going to become more
More
frequent.
frequent.
We're going to have them more frequent as the science increase and you have persons doing different scientific work in different parts of the world. And anything that happens anywhere in the world, it can be at the doorstep in hours.
In
So
hours.
it's something that we need to learn from and how we manage medical records and privacy and confidentiality. You had employers who would ask you, dig into your person. And I'm saying, when did we get to the point when
Unethical. It's unethical.
you can just ask somebody if you have this particular infection, like, you know? So
Yeah,
there's other
but
things.
there were laws against doing that with HIV, but yet all of a sudden this was okay.
And
You know?
it's an infectious disease just the same. So
Exactly.
so that is also a big part of the problem. And I think they got away with a lot because of the fear factor that was behind COVID. Because when you start to people dying and thing, and you have that in the news 24 hours a day and they're pushing that and so on, it played on other people mind. Other people went into panic mode. I know persons who had persons working with them for 25 years, no problem with them at all. And because they say, well, I'm not ready to take the vaccine yet, or I'm not thing, the thing. And it's not that, and again, I'm not against the science because I believe in the science. I work for the science. But you must never ever force anybody to take something that they don't want to take, or penalize them for not doing it.
And again, this is why I would say that, in my humble opinion, I think that the PNP needs to take the lead
Hmm.
in organizing a class action lawsuit
Yeah.
because a lot of people, as you said, lost their
Hmm.
jobs. A lot of people still unemployed because of this thing.
Yeah.
A lot of people have lost not just jobs but homes,
Hmm.
right?
Yeah.
And remember, no, it's not. That is just one aspect. The whole management of the pandemic. I
Of
think that we
course.
need to take a serious look at it.
Yeah, I don't understand why they were allowed, why people for some reason said that they did a good job in the early part of the pandemic.
They did not.
I think the only reason why people said is because of the fear factor, because of how St. Thomas, they closed on St. Thomas quickly. But when you look at if you look at how disease is spread and so on, that wouldn't have stopped in a new population that hasn't been exposed to disease, that wouldn't have stopped it from entering the population and ballooning. But in terms of you have persons they ran out of oxygen. They wanted to
Yes.
fire healthcare personnel in the middle of the pandemic. I mean, it is they did everything that you were not supposed to do. Everything that you were not supposed to do, they did it during the pandemic.
And they think they did a good job. Remember now, while we were locked down, they had tourists coming here
Yeah, and
on
partying, right?
cruise ships, on the planes. They had a
Yeah,
big mocha fest
yeah.
while we were locked down,
But you saw even
spread the
where
disease.
their own ministers got into trouble because of the party that they were having and mocking the
Exactly.
people for staying in. Yeah, persons who were fined. who were fined, who paid
seven hundred
significant
thousand
amount of
dollars, some
funds
big money, little
for
picnic
fines. Yes, for some
for not
basic things
wearing
like not
masks.
wearing mask and being out after curfew hours, even when they had a valid reason for being out and things like
Exactly.
that. So it's something that we really need to sit down and dissect and have a look at and see how we prepare for the next pandemic that we are going to have.
Well, we just have to ensure so this is not the government that we're going to it with, because we can't experience something like this again. Another thing that we need to speak about is what did the minister do with all that money that he got for the management of the pandemic? 400 odd million dollars?
Yeah.
We haven't heard about that.
Yeah, and it's something that we have to definitely look into. As I said to you, we have some auditing that we are going to have to do when as soon as we get into power, because a lot of things went under the radar under the guise of, oh, it's COVID or it's emergency, so we can bypass some of the regular procurement processes and do the emergency procurement, or a lot of projects that were done that you don't get value for money, and all of a sudden they have just disappeared too as well. Some of these projects that you need them, that should have been projects that you kept over the long term, they just disappear. And my thing is this, my thing even throughout the pandemic was, you can't be preaching public health and you go into a community where they don't have running water, or bathroom facilities aren't there, or the road is so bad that an ambulance can't get in and out of the air. If you get sick, they have to somebody have to lift you up and bring you down to the main road and things like that. So it's so when you have things that you have sewage running all, I mean, especially in Kingston, you had
Tell me
sewage
about it.
all over the place. You can't be talking about preventing a pandemic or handling a pandemic well when you had all of those things happening during that time period. So it's something that we know we really need to have to dissect and look into.
Yeah, definitely. All
Hmm.
right. We are at
All right.
9:30 now. I want to
Yes.
open up the box for the people to ask you a few questions. We just
Okay.
want less than half an hour more. Not much because it's late.
Yes.
So we're opening up now. Comrades, if you want to ask Comrade Jesse any question, now is the time. We're only doing this for 25 minutes. We're going to cut off at 10 o'clock sharp. So if you want to ask questions, now is the time. If you want to come up. All right. We're going to open the box. I'm not seeing any requests yet. So we just wait patiently. I guess everybody is satisfied with this interview because it's the
Yes. I
first. I
guess
see
I
nobody
guess
not lining up to come in the box yet.
I guess we basically ran through the major things that we
Yeah, we look like we cover everything for
Mhm.
everybody. Jordan, what about you? Jordan was asking a lot of questions. Wow, this is a sign. Comrade Jesse, we exhausted everything.
Yeah, I think we're thorough. We're thorough.
All right, see somebody here now. Jordan is here. All right, Comrade Jordan. Welcome, Comrade Jordan.
Yes, good night, Miss Right Mango. Good
Good
night,
night.
Comrade Jesse.
Good night.
Comrade Jesse, as I was a big fan of you when the local government election, right? So we
He's a
know,
hero.
we know, we
PNP
know
hero.
that you would have win. We know that the JLP couldn't take that seat, especially when they come around Tarrant Bridge down them side there,
Yes.
where you
Right
have a
here.
lot of comrades around them side there. So we know on the ground how it go. But Comrade Jesse, I was asking Mike in the box about the minister. I saw him coming on in Parliament one time at a speak about the whole issue of he's spending almost $2 billion to send people to the diagnostic services. And me I said then minister, could have take the same money where
Money
you
and,
send the
and
people
fix
go
it
to
and
the
put equipment
diagnostic
in the
service,
hospital. And put
buy the
equipment in the
machine
hospital.
them yourself, instead of
Simple.
you rich your friend them with their
Simple.
apex, X-ray and diagnostic, could have do all of that, minister. Instead of you send people go do the test, you could have made the hospital. There is no hospital I know in the physical world we don't have some diagnostic service at the hospital. From when
Basic.
KPH don't have an MRI machine working or a CT scan machine working, and KPH is the largest hospital. Comrade Jesse, in the entire Caribbean. No man, it is a disgrace and indictment for this minister for saying well, say him have the biggest degree of all public relations and marketing. Say him know how to spin the lies and make it look good. That's all him good for. Spinning truths. I feel him think that, Comrade Jesse.
Yeah. No, you're absolutely correct. They have. That's what I was saying earlier. It's almost like you get the feeling like it's deliberate, not to basically starve the public health system and to outsource everything. It feels that way. That's the only other way I can put it because they have not made the effort to equip the hospitals. They haven't.
Yeah, and then now, Comrade Jesse, the workers them are overloaded. When you have
Yeah, man.
small number of
Yes, sir.
workers with you talk about hundreds of patients.
Yeah, man. They're
You
stressed
know,
right now.
say that will have a toll upon the work. Comrade Jesse, workers are coming down with high blood pressure problem, diabetes problem because of the amount of workload where them have a daytime. Comrade, me I tell you as a person we in the system how it is difficult as a worker to be seeing hundreds of patients vis-a-vis your own self. It is a tall work, and I heard the minister speaking about, Comrade Jesse, that he's going to expand the community health aid workers' responsibility. But the community health aid, them done are going a community, some dangerous, violent communities, Comrade Jesse, and they're not being paid anything extra to go in at these violent areas. If you go check out if the kids them in the areas them have their vaccinated properly, Comrade Jesse. The minister, me don't know if a cuckoo land the minister live in I'm a live in a one land where him live in a different land because him live in a different reality than where the people on the ground there. And the next thing to Comrade Jesse. I was talking to my people on my program too. Comrade Jesse, the Ministry of Constitutional Reform and the Ministry of Digital Transformation. The government could have put them in other departments, put them under existing ministries, and use the money they would have the ministries them operate for and put them in a healthcare. Look, come and just some basic services, basic equipment. Sometimes you as a healthcare worker do not have. You do not have to do your work.
No, it's true. It's true.
Basic thing where you're exposed to when sicknesses are coming into the health center or the hospital. So it is a disgrace on this minister, and the minister should have do the honorable thing. The time I take allegedly give him counselor. The bodies them were travel from Manchester, Mandeville, all over from the CT scanner. The bodies them forgot the autopsy at Spanish Town. He need to do autopsy on him brain.
Yeah,
All right.
correct.
Thank you, Comrade Jordan. Thank you so much.
All
Comrade
right,
Anne
correct.
Marie.
Hi, comrades. Good night.
All right, good
Good
night.
night.
Comrade Jesse, just trying to find out, seeing that you have some knowledge of what is going on at Cornwall Regional, what is the time frame are we Jamaicans looking at down the western side here? When you think it will be completed?
Well, well, I don't think it'll be completed before. My personal opinion, I don't think it'll be completed before the next general election. The adolescent hospital might be finished maybe by the end of the year if they continue to keep up the same pace. One thing.
Which hospital is that? Is that a children's
Yeah, the
hospital?
children's
Yes.
hospital. Yeah, that they're building
Okay.
next door to the renovated Cornwall Regional. But your guess is as good as mine. That's just me guessing. Because every time you think Cornwall Regional will be finished, it drags on. And we're in the 8th year now,
But I'm
and the
seeing
budget keeps expanding.
where right, and I'm seeing where this minister of health, I don't think they report to anybody. I think everybody is just doing their own stuff. Because if he was reporting to the prime minister, um, maybe
Prime Minister know
Everybody in
what
I
going on,
same
man.
barrel.
No, man. The Prime Minister know what going
Everybody
on.
in I same barrel, so me no know.
Yeah,
We just
it's one connection. Trust me, it's one connection. And some
we
of these
just need
things
to
that you
put the
think
whole of them
look
in
like
a one
accident
barrel and
is
roll
not
them
is
down
not.
in our apps
And some of
when
these
them
things
got
that might
seen.
look to you like they're happenstance, they are not. They are well coordinated and planned.
Well coordinated.
So it
Yes, that is true.
one barrel is they're on the same page. Trust me.
Well, it seems like there is no ending to Cornwall Regional be back to
I think
any
when we're going to
form
get to
of
end is when we change the government.
exactly
I
so.
don't think they're pushing to try and finish that pace and find
No
anytime
man, that
soon.
is the
Okay.
cash cow. That's where them go and get them campaign money.
I don't think they're pushing for it.
Well, I think we need to push for some better explanation from
Yeah.
the spin doctor, the PR doctor, Dr. Det, you say, Kamla?
After death, that's what we call him.
We need to push for him to give us, and we need to either stage a demonstration, a peaceful demonstration in this COVID, with this COVID thing that came out with the injections that they gave.
Oh yeah, that one
We,
is
we need we need we need
trust
to
me.
we need to
That
go
one
out
isn't going
there and
away.
when I speak about PNP being radical, people say those are ancient days, but we need to go back to the radical state where we hold these people accountable,
Absolutely.
and by doing so, we need to be out there because I can tell you, if it was ever JLP in opposition, this country would be burned to the
Would have
ground.
burned
It
down
would
already.
only be only
Even a
ash.
piece.
Right.
Exactly.
All right,
Thanks,
comrade.
Anne-Marie.
You
All right,
do have a
comrade.
good night.
Thanks,
Thanks,
you too.
Anne-Marie. Twitch,
Hi, good night.
good night.
Hey, good night.
Yeah, hi. I have two things I would like to say, and I'm gonna leave it at two because this is a long, long topic. We could go on and on. So first thing first, I listened to him keenly when he spoke about investing in education and studies with the individuals that he needs to put in place for several departments and facilities to facilitate and aid with different parts of the care center. So, my thing is, if you are going to wait on the educational part of the aspect before you implement the necessary services, what is going to happen to the people that are now ill with the sicknesses and diseases that needs those care?
Okay.
And what about the persons in the country that are actually going to UE right now and the different colleges and who you send overseas with scholarships to study in these different sectors?
Yeah.
Why not use them as study students to continue the process until whatever educational uh, um, thing that you are doing is completed? And the next thing is, can we please do a thorough research and study of what happened previously to break down certain systems, especially within the healthcare sector, so that when we develop these new centers and systems, we don't fall short within those same mistakes again.
All
You have a
right.
great night.
All right. Thank you. All right. So those are some very good questions. So first thing to start with, I am not saying that we shouldn't pay attention to the current challenges that we're having. No, I'm saying yes, we have to pay attention to them, and I even go as far as that we should have temporary field hospitals being created, and also where you can, because to build a theater, all of it don't have to be out of concrete and stuff. You can build emergency theaters, just like what they do in wartime, because that is where we are
Exactly.
now, and to get some of those surgeries done that you can do under those conditions to get them done. So we're talking about going into emergency mode actually and pushing to get some of these things done. But while you're doing that, you don't want to be in emergency mode chronically or indefinitely. So while you're doing that, there are some specialties that don't take that long, especially if you're already trained to be specialized, to become a specialist in those areas. It don't take that long for you to get that kind of training. And some of them can be done right here in Jamaica, the training.
Exactly.
So those that you can reap, that you can do here, you do them here. And those persons who we have available that can get that training, and some of those training, you can be working in the hospital and doing the training at the same time.
Most of them, yeah.
Right. So you employ that strategy for some things that you might want for those specialties, try to use those new techniques and to use the new equipment that you have out there and to be exposed to the new technology that you might have in a China that you won't necessarily that you won't see in the States if you go, or you might have in the States, or that you might have in Germany that you won't see anywhere else in the world. 'Cause Germany is number one in command to especially sports medicine and surgery and so on. And so
That's my specialty.
yes, what you want to do now is to take up those persons.
Germany is the gold standard.
Absolutely. So you want to get a crop of persons, whether they are in school now, being trained now,
I'll go, send
exactly, or
me.
you have persons like Kamla who already have training and experience, and would want maybe to learn something in a particular area. You say, okay,
Yes,
you go whether it's for 6 months or a year or whatever it is,
exactly.
on an accelerated program, because remember we want you to be back on time,
You
and we
need
send you.
those.
And I'm
Exactly.
saying with these countries, what we can do is have partnerships with them, because the truth of the matter is that I don't love the free business, especially when it's taken from bigger countries. We
They're
can say
trying right now. Listen,
we
they
can
are
say
trying right now.
we are experts when it come on to music or to running or to
The
whatever it
track
is.
and field.
And we can say we will
Yeah.
train some of your people, and you think, or we will teach some of your people, whether it's
Do
English
an
or whatever it is,
exchange. Do an
some sort of
exchange with
knowledge
GC Foster.
exchange.
So some of them come out here to be
Absolutely,
trained as coaches. That's what,
100%.
oh, exactly. Because we have that system down pat, that whole
Absolutely.
athletics training.
And what will happen to your healthcare when you have persons in these different countries across the world getting these different, you have different ideas and different techniques and different equipment that you can use to fix the same problem. So you
Exactly.
now end up becoming an expert because you have all these different ways of doing the same thing. It's a way of getting knowledge from these different places back
Yep.
home on our side. So it's about using everybody along the stream. Those that are in school now, those are about to go into school, those have already gone to school already and want to specialize in a particular area. So that is something that
Yes,
we're
John, you
definitely
can
pushing.
call in. Somebody else asking if they can. Yes, John, come in.
So that
Go
is
ahead.
really what we are absolutely pushing for. So it's not that we're just going to pause and say we're going to wait 4 or 5 years for somebody to be trained and then we're going, no. It's about doing everything simultaneously, attacking every part of the cycle, so that at the end of the day, so when you look back after 5 years has passed, and every year, if you do it like that, every year you see continuous improvement. That's what you'll be seeing every year.
Exactly.
And then until you get those big jumps, big leaps in improvement for at your 5 year and your 10 year mark. Because some of the massive improvements you won't see it until some years has passed. But if you're consistently putting in the effort over the years, each year you'll have something to celebrate and to be proud of.
But
You know,
that's
so
what we did with the sports, with the entire sports program.
absolutely.
We sent people to Cuba to be trained,
And
and they came back. Yeah,
yeah, and one of the things we have to do too as well, we have to tie the healthcare with the education. The reason
exactly.
why I say you have to tie them because you can't even do a proper health promotion if you don't have a basic level of education. So
Exactly.
you can be saying a particular message and using all these words and whatever, and people don't understand not what you're saying. They can't read the pamphlet that they're giving them, nothing. So you have to have that. So you have to always keep them both tied together, and they can both follow the same model. That type of knowledge exchange and getting expertise in the different areas to get it done. So it's something that we can is doable. These are doable things. They are not pie in the sky. They're not even the
Exactly, Twitch.
outer reach things. These are
Not
things that we
outer
can do.
reach.
These are things that we can do. You know, we have plants here that we can partner with persons, develop particular drugs from them. If we don't have the expertise yet to do it, we can do that. We can say, well, I have a plant. I suspect it can do X, Y, and Z, or I have some sort of evidence already that it can thing. I remember in we had a dengue outbreak, you had the papa thing. You can say, well, let us break this down and see what in it we can extract or what we can use to
The
say, well,
Indians already did that.
we can drink. So these are the things we can't ignore. Our plants. They are
Exactly.
extreme. They are very valuable. So that's what we can do. I think I covered all of the questions. I'm not sure if there was another one.
Yes, yes, you have. I do
Okay.
see there's somebody else who wanted to come, but I sent him an invite and him never come. So I
All right.
think that's it. And we do
Okay.
it. You still have
Thank
7 minutes to go. So anybody else, if you who wants somebody else asking to be let in, let me see. I'm checking. Somebody just sent me a message to be let in. I'm looking for you. I invited you over 28, so I'm waiting for you to accept the invitation now to come up. There we go. Hi, Ava.
Hi, good night.
Good night.
you.
I have a question. I'm asking how they plan to fund all of this thing that he's saying.
All right. So the funding argument is where we normally go to first, and I'm saying to you that it costs us way more money to operate how we're operating now. One of the things that I said earlier up in the interview is that the diaspora, I believe that we should have a fund from the diaspora where they contribute to both education and healthcare in a 60-40 split. And I was also making the point that sometimes people don't want to donate to anything that is controlled by political persons. So you can set up a committee to deal with that specifically, where they tackle specific projects. In terms of the training, there are many times we are negotiating with different countries, and we instead of asking for training, we accept money or we accept gifts that are not lasting. So, for example, I would prefer, whenever you have, whether it's for road construction, when we have Chinese doing it or whoever doing it, when we are negotiating for anything, if we make education and healthcare a priority, we can say we want you to train 100 of our people if you want to do X. We want you to train, so we should be pushing for that instead of just saying, oh, we want X amount of money, or we want you to give us this particular gift or whatever it is. Focus on building your human capacity. If it's a gift, it must be equipment along with the training to maintain the equipment too as well. To use it and to maintain it. So it's about the long term, ensuring that the gifts are long term. So some of these things are not things that you even have to dig into your pocket any at all. And we spoke just now about the knowledge exchange. So for example, you have expertise in a particular area. I come to you and I say to you, okay, I will train your people how teach them how to run fast. If you train 100 of my people how to be the best neurosurgeons there is on the planet, because you are the expert in that. And there's no money being exchanged there. It's just a exchange of
Exchange.
so so I'm saying there are ways to build your capacity on the cheap end. Yes, there might be some cases where you have to spend money, and even when you do spend money, it's costing you way less than when you turn up to the hospital and you have 100 people waiting to see a urologist and you don't have any, or somebody who are cardiologist and you don't have any, or the one they have is overworked and overburdened and can't see you get an appointment, or a rheumatologist with your autoimmune diseases and so
Autoimmune.
we have to wait months to get an appointment date to see. Instead
Yep.
of that happening, the cost that comes with that pure persons don't tend to calculate most times is way more than if you had decided to go and train even 5 of those persons at full cost to the government, because they're coming back to give that kind of service to your country and you can have them for a particular period of time too as well. So the benefits definitely outweigh the costs of doing what we're talking about. It's something that we just have to decide that we want to do. It's just the same way when I say to people that we need to now invest in our non-traditional high schools, so that if you want to reap the rewards of lower crime later on,
Exactly.
and reduce your hospital bill from persons who are victims of crime and the mental and emotional damage that you have and the spill-off effects that you have from crime. They're going to tell you, no, we can't afford it and thing. But when you don't spend the money to have
For in the long run.
you spend way more money on it later on when now you have to lock up somebody in prison and feed them for many years. They have killed somebody and or injured somebody where you now have to fund the healthcare for that person. So the spin-off effects is way more than actually investing in it. It's something that we need to do.
All right,
It
Ava.
was done before. Remember that the PNP is the party that liberated, that made people, the regular people like me and you, be able to become professionals in healthcare
That's
or
right.
in any area at all. It
What
was
is your profession? You didn't say. What's your profession?
I'm a medical technologist. I'm also a food scientist as well. I
I
focus on
did not know that.
yeah, man.
Cool. All right.
I'm now
Nice.
doing some work in public health.
Ah, nice. All right, John, go ahead with your question. John, unmute. I'm trying to unmute, John. John, unmute yourself. You're muted, John. Unmute your mic. I'm not seeing where I must unmute your mic.
Yeah. So until he unmutes his mic, it's about partnership. As I said to you before, the major things like healthcare and education, those things you have to partner up to get them done. It's not something you can just stand
Okay,
alone.
he's unmuted now. John, go ahead.
Yes, can you hear me now?
Yes, we're hearing you.
Good, good. Good night, Camilla. Good
Is
night,
this covered back here?
John McKay. Yes.
What's up, sir?
Yes, man. But come with Jesse, I'm really proud of you, and I really love your vision towards the healthcare and healthcare system and so on. And I really love the point that you make about work and train kind of thing. But my question is this: how could you can you use the nurses to make the doctor job easier? Like instead of to use just doctor, you could probably promote nurses
Yeah,
to be
nurse practitioners.
right. You know,
Yeah.
and they could help to make the doctor job easier. You could use them in health centers and so on. I know some time ago, I think I hear you make mention of it. So what you plan towards that?
No, absolutely. If we bolster every area of healthcare and all those persons who play a direct role in healthcare, it makes everybody's job easier at the end of the day. All the players in healthcare, because if we give the nurses like your nurse practitioners the right to write,
Autonomy.
yeah, to do prescriptions and
Prescriptive rights, which is
right
something they have been fighting for
for a long
decades.
time. And in other countries they do have that kind of authority. Even the
This
states.
is the only country, this is one of the
Yeah.
only countries in the world where, number one, I'm sorry to interject here, but this is a very important point to show you how backwards we are. Nurse practitioners have no prescriptive rights, and physiotherapists are not first contact officers. That's we're like one of the only countries in the world.
You're right.
Yeah, so it's something that we definitely have to look into. So as Kamna said, it's something that we are behind the ball as it relates to that. And I think part of the problem too is that we have a mindset here too that once you think healthcare, we only think doctors and nurses. Those are the two persons that come to your mind.
Exactly.
The scientist who is behind the scene developing the drug or doing the different
The med tech.
Right.
The med tech that handle all of the blood products.
and all of that. The nutritionists, because that is also important too as well.
Exactly.
The counseling, all these different areas, the physical therapy, the all of the different areas you can think of in healthcare. Radiographers, all of those persons. We forget about them most times. And they're absolutely important. Very, very.
We have an entire. We are so many of us. We can't even be registered under the same organization as the doctors.
A group that we forget to is your when especially come on to public health, they are very important. You see, your auxiliary workers and your porters
Ancillaries.
in your hospitals,
Exactly.
they can break your public health system.
There you go.
So most times we tend to leave them out too as well, and they are very important. Very, very
Very,
important.
very important. Probably, perhaps the most important.
Yeah. So
And that's where it starts.
so
Because
it's really bolstering all those different persons and providing the training and the exposure. You know, that is
and proper equipment.
yeah.
Yeah.
And to get it done. We can get it done.
And one more thing again, Comrade Jesse. Claude McKay sent his greetings and said to say hi to you.
All right. Big up
All
Comrade
right.
Claude McKay and the entire McKay family.
All right.
Nice.
All right. Take
Cool.
care, sir. All right. God bless.
Thank you, Comrade John. Thank you so
All right.
much. All
Okay.
right. Take care.
Bye-bye.
Cool.
All right. All right. I think that is it, Comrade Jesse.
Thank you so much for having me.
This has been a very, very, very interesting conversation. Believe me. I don't think anybody can complain. Anybody can complain. It was really enlightening. You understand? Very educational. So from the bottom of my heart, thank you for
And
coming.
thank you too. Thank you too. And
Yeah,
thanks
man.
to the listeners too as well.
Yeah. All right. Take care.
Mhm.